Good to have you with us. Weather looks nice this weekend. We've got pleasant weather. Tigers playing Mississippi State. Weather looks good for that. Jags playing. Weather looks good for that. Although we do have some rain in the forecast for next week. We'll get to that upcoming. A lot to talk about on the show. But let's talk about something that's coming up that's quite frankly pressing. There is a deadline. The annual enrollment period for Medicare enrollment is now through December 7th. So you've got until December 7th, a little less than a month, to evaluate your Medicare options and make some changes to the plan that you're in. So let's get some insight. John Van Wart is the Vice President of Sales and Marketing at People's Health. John, good morning.
Thank you.
Pleasure to have you here.
You too, Matt. Nice to be here.
This is one of those times of the year when the clock is ticking. And you all do a lot of advertising to let seniors know it's ticking. You have to evaluate your options. What options should people be looking for?
Sure, that's a good question. This is the time of year to be asking that question. The federal government allows people on Medicare, those folks who have a red, white, and blue card for Medicare, Medicare insurance, hospital and medical insurance, allows those folks, 48 million Americans, to choose a Medicare Advantage plan between October 7th and October 15th and December 7th.
Right.
So they evaluate their Medicare Advantage options, and this is the time of year to do that.
All right, let's talk about some ground rules. First of all, if you like the plan you've got, you do nothing. You don't have to fill out a form to re-register or anything. If you like the plan you're in, you just sit tight, correct?
Exactly correct.
Okay. What are some things, John, that you think people need, seniors, need to look at as they evaluate their plan? What do they need to look for? What are the things they need to say, this is an option I need to consider?
Sure. You want to compare co-payments from plan to plan. Obviously, if you're in original Medicare, there are deductibles, there's co-payments. You need to purchase a Medicare supplement or Medigap policy. They're expensive. You have to also look at buying a Part D plan for drug coverage.
Okay.
Or you can compare the Medicare Advantage option, which some 13, 14 million Americans have chosen. So really pay attention to the plan benefits, the network of providers, the doctors within that plan.
Boy, it's a lot to consider, isn't it?
Sure is, yeah.
Do you all find that, at People's Health, that people just get overwhelmed? They just get overwhelmed. Yeah. Seniors are sitting there saying, oh my goodness, it's so much to consider, especially for first-time enrollees, right?
Correct. It is what it is. Like I said, there's 48 million Americans on Medicare. 13, 14 million Americans have chosen Medicare Advantage. Medicare.gov is a great website to visit. The toll-free 1-800-MEDICARE. Obviously, visit us at peopleshealth.com.
Okay.
But we have professionals that can help that decision easier, be made a lot easier.
Okay. Let's talk about some of the things you all offer. You all have something called Choices Select. It's an HMO plan. It was available only in a few parishes in southeastern Louisiana. You all have expanded that now, correct?
We have, yes, Matt. We're now proud to be proudly serving 23 parishes here in southeast Louisiana.
Okay.
Greater New Orleans, Baton Rouge area, and the Bayou area. We have plans available for folks who are on Medicare and Medicaid, or folks who are just on Medicare. We have 50,000 members here in southeast Louisiana. I'm looking forward to helping out other people on Medicare.
You offer still some $0 premium options. So what I'm seeing here is you have a lot of flexibility.
Yes,
okay.
We do. We have a zero plan premium available. There's no monthly fee. There are low co-payments along the way, and it's a different way to get your health care than through original Medicare, which is a lot more expensive.
Let's go back to the beginning of our conversation. To be eligible for Medicare, you must be 65. So you all can help people who have never been on Medicare, who are contemplating what decision to make for the first time, or for those who are looking to renew or change plans. You have till December 7th, either way.
Correct. And it's, to be specific, it's a red, white, and blue card, Medicare card, and actually you can be on Medicare at any age, Matt. Most folks are 65 years old or older.
True. I forgot about
but you could be disabled. Yeah, there's some disabled folks.
I forgot about disabilities and things. You're right about that. Okay.
And probably out of 100 Americans on Medicare, probably 20 would be on Medicare through disability. About 80, though, would be on Medicare through age.
As it relates specifically to Peoples, you guys are expanding. You are really growing rapidly.
Yeah, popular demand. The aging population, baby boomers, as you know, folks born between 1946 and 1964, soon to be nearly 80 million Americans on 65 or over by the year 2030. So here in southeast Louisiana, we'll be servicing a market of some 370,000 people on Medicare.
Right. If you want to know more, the website is so simple. It's peopleshealth.com.
peopleshealth.com. That's it, peopleshealth.com, or simply call 800-978-9765, and you can learn more whether you're a first-time enrollee or you just want to get information about your current plan, make a comparison. They can help you out. John, thank you so much.
Thank you, Matt. Nice to be here.
Appreciate you being here. Thank you so much. Okay,
we'll be right back. We've got much more Baton Rouge Lagniappe coming up in just a moment.